And together, we will move mountains. And if they don't hear our message, then we'll just do it over and over and over and over 1,000 times again for you. And I'll rise up, I'll rise like the day, I'll rise up in spite of the end. I will rise, we will rise, we will rise, we will rise up.
Hello, my name is Michelle Zabel and my pronouns are she and her. I'm an assistant dean at the University of Maryland School of Social Work and the proud director of the Institute for Innovation and Implementation. Today, I'm just delighted to welcome you to this Training Institute live workshop. As you might have come to expect with all your favorite conferences, the Training Institutes are now virtual. And although I know we'd all like to be together in person, we are excited to host the Virtual Training Institutes and really want to encourage you to continue to join us on the first Thursday of every month through August. Each month, you'll have a choice of 2 back-to-back workshops. So mark your calendars, choose your workshops, and make sure you reserve your place early so that you can attend the workshop that most interests you. Today, I want to encourage you to actively participate by using the chat to post your questions, post your comments, and share your resources with your colleagues. Our presenters, they definitely want to hear from you. And it is absolutely your participation that will make each of these sessions a success. As a reminder, staff are monitoring the chat and they're going to make sure the facilitators see your questions and comments, so be sure and engage. A few other reminders to include: if you need assistance at any time navigating through these virtual spaces or accessing links to workshops, we do have a live help desk support standing by to assist. We are also providing a certificate of attendance after the completion of each workshop, and all of our workshops are being recorded, so by you participating, you're implying consent. Finally, there will be an ASL interpreter or closed captioning available during each workshop. Those interpreters can be pinned when available for those who require interpretation by hovering over the interpreter's video and selecting the 3 dots. One of the options that will appear is Pin Video. By selecting the Pin Video, this video will not move out of view. Following the workshop, we will have a wellness and mindfulness break with guided activities before our second afternoon session. With our theme, What Could Be? Bolder Systems and Brighter Futures for Children, Youth, Young Adults, and Their Families, all of our sessions will challenge us to envision a future where the voices of children, youth, young adults, and their families are elevated, especially those who are most frequently silenced or marginalized, where we use the best data and research available to challenge ourselves, developing new ideas and approaches that can be implemented to meet the needs of youth and families, and in service of our commitment to social justice and the elimination of disproportionality and disparities. My hope is that today's session will provide you with food for thought as you consider your next steps in creating a vibrant, equitable future for youth with complex needs and their families. Please don't forget to register for next month's workshop. Remember, they're held the first Thursday of every month, and you can visit the institute.umaryland.edu for the full schedule. Thank you so much for joining us, and I look forward to seeing you next month.
Thank you so much to the Institutes and Michelle for that introduction. I'm Sharon Hoover, and I co-direct the National Center for School Mental Health at the University of Maryland School of Medicine. I'm joined today by Dr. Samantha Reeves, one of our postdoctoral fellows and soon-to-be faculty member in our School of Medicine. We're both within the Division of Child and Adolescent Psychiatry at our School of Medicine, and we could not be more delighted than to be here today to talk with you all about comprehensive school mental health systems. And I was really heartened watching the chat box in the beginning, seeing how many people we have from across the nation who are really eager to learn and share about work at the intersection of education and mental health. So we hope to impart some resources and hopefully some wisdom with you that will be helpful to you as you go back to your own communities and do this good work. And we also encourage you to use the chat box to share your wisdom and your expertise and your resources. We'll certainly be sharing some along the way, but please feel encouraged to do the same. This is a collective opportunity for us to share the best of what's out there. I love the theme of what could be that we see throughout the training institutes, and I really think this is a moment in time where we need to seize opportunities and lessons learned from this complex year that we've all been through. So without further ado, I'm going to go ahead and get us started and share with you a little bit about what we hope to accomplish during our time together today. So again, these are the co-presenters, Sharon Hoover, Samantha Reeves, and we're with the National Center for School Mental Health. Let me first just share a little bit about our National Center. We've been around for some time now, over a quarter century. So since 1995, we have been charged by the Health Resources and Services Administration. Our mission is to strengthen policies and programs in school mental health to improve learning and promote success for America's youth. And we do this in a variety of ways, through research, through practice, through training, through policy work. You can find out more about what we do at schoolmentalhealth.org, and you can see that link here. And as we share some links with you throughout the presentation, I believe our moderator is graciously also putting those in the chat box, so you should be able to find those in multiple places. These are our objectives for today. So first, we are going to touch on the value and impact of effective school mental health, but we're also going to do so in the context of student and educator mental health needs that are specific to COVID-19. Again, we've been in this complex year, and we know that the landscape of school mental health has shifted, and so we're going to touch on that. We will also talk about the core features of comprehensive school mental health systems, and then really close with some strategies for wide-scale implementation of comprehensive school mental health systems at the system and also at the service delivery levels. So that's what we hope to accomplish in our 90 minutes or so with you. At our National Center for School Mental Health, we are committed to conducting all of our work through a racial and social justice lens, and we will continue our work to support culturally responsive, anti-racist, and equitable practices at this intersection of education and mental health, with a specific focus on Black, Indigenous, and all people of color. Further, we recognize that through addressing structural and systemic injustices that have long been present in education and mental health systems, school health and mental health systems really have opportunities to develop and model equitable and anti-racist policies and practices. And so we're committed to learning and healing and growing together. Again, this is how we hope to spend our time together. We'll start with student and educator mental health needs during COVID. We'll define what we mean by comprehensive school mental health systems, and then we'll walk through the tiers, mental health promotion for all students, as well as tiers 2 and 3, early identification, intervention, all the way to crisis response in the school context. We'll talk both about best practices always, and then some things that have emerged in the context of COVID-19, both innovations and again, some lessons learned. And then finally, we'll close out with some resources that we hope will be useful to you all as you are navigating and building your comprehensive school mental health systems. So let's go ahead and start with student and educator mental health needs during COVID-19 and talk about the context that we are all in. Really this combination of the global pandemic, large scale and extended school closures, reliance on distance learning for many, social distancing, and also certainly the recent national attention to longstanding and pervasive social injustices and racial injustices is unprecedented. So we are, as many have said, in unprecedented time. And in some respects, we could argue that we really lack empirical evidence for what would work right now in this unique context. On the other hand, there is a lot that we can draw on from best practices that existed pre-COVID, and so we'll touch on some of that today, and also significant innovation that we have seen in the context of COVID. specific to school mental health during COVID-19. So we hope to share some of that. The bottom line is there is a lot going on for students, for families, for staff in schools, with some restarting, reopening, engaging in different models of learning, hybrid learning, and so forth. Some have been open for a long time now, but still the landscape is quite different. And so when we think about kind of what our students and families and educators are experiencing, we think first about the collective stress during COVID-19 and the impact of that. We know that's ongoing. We also layer that on other existing stressors that—
Hey, Sharon?
Yeah.
I just want to let you know that your mic is a little low. Some of the people are having a hard time hearing you.
Okay. All right, let me, I can certainly change the mic if I need to. Let me do that real quick. Is that better?
That's perfect.
Okay, sorry about that. I know audio is very important to our listeners, so thank you for the feedback, and we hope that this will be better throughout the presentation. Okay. So again, we're talking about the context of COVID. We know that for many young people, there are existing stressors, both on our young people as well as our families and school personnel. And COVID-19 is not the first adversity or stress that many students and families have faced. And so again, there is this layering of adversity or trauma for many of our young people. And we also know that all of these things are really being experienced and understood within this national context of events, including our socio-political context, and that there are some commonalities among people's experiences, but also certainly unique aspects. And how youth and adults respond to all of these is really affected by this complex intersection of what we might think of as risk and protective factors that either promote or detract from resilience and well-being. So our colleagues at the National Center for Safe Supportive Learning Environments broke down some of these stressors that our schools and our young people and families are experiencing during COVID into three kind of core areas that I have found helpful in thinking about kind of how we do this work in the context of COVID-19. So first, they talk about anxiety and fears. And we know that there are increased challenges with mental health issues. Some young people who weren't experiencing mental health concerns pre-COVID now are. Some who were experiencing mental health concerns, these have been exacerbated in the context of COVID. I will comment that for some of our young people, the shifts in the learning landscape have actually been helpful. And so I think there's a lot for us to learn in terms of individualized learning and how we can tailor the learning context and the mental health context depending on people's needs and strengths. We also know that there's confusion and uncertainty about what will happen next, and that really goes for all of us, but certainly for our young people as well. There is worry and fear for the safety of self and others. For teachers, this may be worry about their students, and we're going to speak about the educators' experience shortly. We also know that there's anxiety related to unknowns, really new ways of operating in this current academic year. There's a lot of discussion around kind of the next academic year and what that might look like. Fears associated with reopening of schools, COVID transmission, a lot of pressure and confusion and uncertainty and stress in our education community. And then we also know that for many of our young people and families, they are experiencing new or worsening unsafe situations at home that may include abuse, neglect, and domestic violence. So we'll speak to some of that. Another category of the current context really is loss. We know in part, many families are experiencing a loss of resources, extended family support, job loss, access to mental health services. We also know that we have these real losses of family members, community members, teachers, and students. I think it's, you'd be hard pressed to find at this point people who haven't lost members of their circles. And so we're experiencing this grief and loss related to loss of human life. Students and staff are missing out on these important rituals and transitions. And we know that for child development, these are so critical, whether it's prom or graduation or end of year celebrations, goodbyes, losses, starts of new schools. These are all really really important transitions. And so when we've lost out on these, it can have, deleterious effects for our young people. And then certainly just the disruption in normal routines, relationship structures, and that predictability has been really burdensome for our young people. We know that there are bigger social influencers of health that have also been tied to these losses, whether it's housing insecurity or food insecurity. So again, loss is a big theme here. And then finally, and we know there's been quite a bit of justified attention to the issues of equity that have been uncovered and amplified in the context of COVID-19. We know COVID-19 has had disproportionate effects, both with respect to the health burden, but also in terms of the impact of other stressors that are COVID related. We know that there's been disproportionate access in the school environment to virtual education, and so the learning landscape has been particularly burdensome for our communities of color. And there hasn't been equity either in terms of the resources and tools for our educators to learn new technology, adapt to different ways of teaching and learning. And so all of these complex variables have just layered in terms of the stress that our young people and families and educators are experiencing. What do we know about virtual learning? Because some have said, well, we know there's evidence that virtual learning is effective, and there is evidence of that. We know that virtual learning can be effective when students have consistent access to computers and internet, and teachers have been trained and prepared for virtual learning. We know that it's effective usually when remote schooling is available in terms of space, quiet, devices. But we know that in the context of COVID, this was an abrupt shift in the learning environment. And we know that many have had reduced time from virtual learning. And this reduced time really has impeded their achievement and their development. And as students return to school, these have to be taken into account in terms of how do we allocate resources so that we have more equitable response. So we'd love to hear from you in the chat box about what you have seen, what you've experienced, what you've heard as the greatest child and adolescent mental health needs, really in this context of COVID and in the context of our shifted learning landscape, our school closures, our schooling, and kind of what that looks like. So we would love to hear from you in the chat box about what you have seen as some of the greatest mental health needs that you're hearing about. I'm going to see if I can pull up our chat as yeah, it looks like I can. Okay, and just a reminder when chatting, please be sure to select all panelists and attendees in the drop-down menu next to 2 so that everybody can see that. Okay. Yeah, so we're hearing already from folks depression, isolation, increasing growth of social anxiety, perhaps mostly for some of our secondary students, seen anxiety pop up a number of times, and this idea of loss of connection, isolation, disconnection, poor coping, teachers needing support. So keep those coming, and I encourage you all to continue looking into the chat box to hear what your colleagues and neighbors are saying about what our young people and schools are experiencing right now. And when we look to the CDC literature on school connectedness and how important that is for students' positive youth development, this is concerning that we're seeing so much disconnection from the school environment at this point. We're hearing some specific stories from people about their own experiences as a parent, as an educator. So thank you for sharing those. Worries that your children are not getting the fundamental academic skills. We're hearing that from a lot of parents at this point. Lack of social emotional learning, both for students and for parents. Not around their peers, that's been a real concern. Again, particularly for some of those secondary students, but also was on a radio panel yesterday, and we heard from parents of young children who are really worried about that important socialization that can happen in the early years and how we can foster some of that at home if they're not able to have those social interactions. So thank you for sharing some of those concerns that you've seen in your own home, in your own schools, and in your community. And we're going to talk about what schools are doing to address some of those in the context of school mental health. We know that mental health needs of young people have certainly drawn attention in the national conversation of mental health. We know that our school leaders at the state levels, at the district level, are concerned about the well-being of their young people. Certainly there have been a number of students who they've had no contact with over the course of virtual learning, and so they're concerned about that. But even those where there has been contact, there are concerns about mental health, and we're seeing this crop up more and more in the headlines. And it's important in terms of awareness raising that we are seeing this in our media. At the same time, we want to draw some caution around this and not sensationalize some of the impacts. There was a really fantastic article in the Lancet a couple of months back talking about the need for caution when reporting about the mental health impacts of COVID. We don't want to do harm, and when we suggest, for example, concerns about increases in suicidality without the data there to back it up, it can really cause more harm than help. And so we have to be cautious, and yet at the same time, we do want to recognize and put buffers and protective factors in place to support young people in schools. And there is cause for concern, right? So there were a number of studies that were done in the early stages of virtual learning. This is one example, a national sample where they surveyed adolescents and found that about a quarter indicated being disconnected from peers and adults more so than pre-COVID. Again, that's not too surprising given the social distancing measures that were put in place. Over half concerned about physical and emotional health of their family. Many reported disrupted sleep due to anxiety, feelings of depression, under constant strain. And many at that time reported that they hadn't been offered social emotional support from an adult in their school. Now, keep in mind, this was done in late April, early May of 2000. So this is when schools, communities were really just trying to get the immediate supports available to families. I would say over the last several months, schools in earnest have put social emotional supports in place and really tried to reach a lot of young people. And so we've seen really some great progress in that area. But again, we have cause for concern in terms of thinking about what is happening with youth mental health. We know when we looked at prior data of past pandemics that they were associated with increases in depression, anxiety, stigma, shaming. When we look at some of the data, for example, with the Ebola epidemic, with the H1N1 pandemic, and even the negative impacts of other large-scale community crises like natural disasters. There was some really excellent data coming out of Hurricanes Katrina and Rita with several years out demonstrating the long-term negative impacts both on children's behavioral health and academic functioning when supports were not there to support them following these natural disasters. We have reason to believe, and now increasingly data to support, that this global pandemic is impacting children's mental health with increases in anxiety for our youngest ones, increases in tantrums and meltdowns, increases in depressive symptoms, inattention and difficulty engaging, and also learning difficulties. We know that, again, from prior studies in the context of epidemics and pandemics, and in this case, particularly from SARS in the early 2000s, we saw that as our young people became more emotionally distressed, they started abandoning some of those measures that were put in place for public health, in this case, stay-at-home protocols. And so there's another cause for concern that we know our young people are experiencing distress, and while these measures may be critical to their physical health and well-being, the more distressed they become, perhaps the more likely they are to abandon some of those social distancing measures. And yet there's also data suggesting that when schools, when government officials, when families did still hold to those restrictions, that adolescents, despite some pushing back of those, were more likely to actually engage in some of the public health measures like social distancing. So where are schools reopening in the US, and kind of what is the current landscape of learning for our young people? We know that across the globe, 188 countries did shut down schools. About 90% of kids had been out of school in some form during COVID school closures. And as you all know, the status of reopening is highly variable across the globe and including in the United States. And this national map tracks each state's mandates on K through 12 in-person learning due to COVID. Some states may not weigh in on all the school operations, leaving the decisions really up to the local authorities. You can see here at least 5 states require in-person learning to be available in some or all grades. And you can go to the link that's here just to kind of look at the state-by-state breakdown of schools reopening. So some are requiring reopening, some have required that schools not open, and then many it's really variable depending on the local jurisdictions. So what we know in terms of what this means for kids is that, and families, is that there's a lot of unpredictability about kind of what's happening in their schools, and even in those communities where schools have reopened. There's often kind of a hybrid model in place, or schools are opening and then closing again, depending on transmission rates and infection rates in their community. What does this mean for parents? We know that particularly in the context of the intersection of mental health and schooling, there is a tremendous amount of stress. Some of the data that has come out, not surprisingly, indicates that parents are significantly more stressed than non-parents in the context of COVID, and that almost 3/4 of parents report that distance learning is a major source of stress. Other sources of stress for parents include basic needs, healthcare services, missing major milestones, and we also know that people of color are significantly more likely to experience stress related to COVID, and this includes our families. There's some other indicators that show that these layers of burden and stress may have caused rise in other areas of concern. So although we've seen some decrease in some of our more traditional child abuse reporting, likely related to school closures, where a lot of our reporters do exist, we have seen an increase in calls to some of our national crisis hotlines. So for example, here you see a 20% increase in calls and over 400% increase in texts to the Child Help National Crisis, National Child Abuse Hotline rather, and about a 22% increase in monthly calls from youth to the National Sexual Assault Hotline. So these are just a couple of the highlights of some of the areas where we anticipate we're seeing more burden on our young people and families. And there's also, from our international colleagues, more data to suggest that family violence has also increased in the context of COVID, likely attributable to some of the layering of these burdens and stressors that we've already talked about. So that's our students, our families. How are our educators doing? Researchers from RAND surveyed a nationally representative sample of K through 12 educators. Some of you may have seen this. They also surveyed principals to look at how schools are navigating these challenging times. And this was sent out really toward the end of the last academic year. And in fact, I just saw in my inbox today another report from RAND on educators' reports of some of the burdens associated with COVID. And so encourage you all to check that out. And a lot of them mimic what we see here. So I know there's a lot of numbers and words on this slide, so I'm just going to point out a couple of highlights. For principals, so our school administrators, some of the major limitations that they reported included lack of internet access for students, concerns about equitable instruction, inability to communicate with students and families, and then lack of technology services for students, and also financial constraints. This figure here shows the areas that have become a higher priority for principals in the spring, and they have these results broken down by high and low poverty schools. The priority areas that really were the same for our principals, regardless of school status, included planning for school closures and other emergencies, and enacting these new social emotional learning interventions or initiatives. And some were higher priority for both groups, but considered a high priority for more principals in the high poverty schools. And those included things like addressing disparities in academic performance, ensuring health and safety of students, engaging with families, and engaging students in learning. So looking now at how the teachers responded to these surveys and some of the things that they listed as major support needs, the highest included things like strategies to keep students engaged and motivated remotely, resources to address the loss of hands-on learning, guidance and tools for assessing student well-being, tools for counselors and school psychologists, and social emotional lesson plans. So a lot of our educators are trying to infuse social emotional competencies and lessons into their schooling, recognizing that right now those social emotional concerns may be prevailing in terms of what's most critical for our students. The survey also included a section where teachers could report their concerns about the pandemic and other issues related to school closure. measures. 4 areas that really stuck out in this figure were rated as moderate to major concerns. A majority of teachers rated moderate to high concerns about their own health or the health of their loved ones, responsibilities to care for their own children and loved ones, feelings of burnout, and concerns about the well-being of their students. And for our educators conducting distance learning, this may be the reality of their experience. So for some, they have students where their cameras are on, but the students' cameras are on, but it's still, if you're an educator yourself or you've spoken with educators, it is really difficult to engage in this two-dimensional world. And for many of our educators, they're seeing more what it appears on the right side of your screen, which is just a bunch of boxes that have a letter or a student listed on there. And it's incredibly hard for our educators and for our students, frankly, and you can imagine it takes a toll on our educators. This statement stood out to me from a middle school teacher in Washington State whose district had been remote for a year at this point. I spend all day staring at a screen and kind of generating enthusiasm into the void that Zoom is, and I end the day so tired and so done and so frustrated. The moments of joy I used to have are so much more rare. And frankly, I think this is the experience of a number of our educators who are trying to support the learning of their students and the academic or the social emotional needs of their students, as well as keeping their own spirits up. There have been a number of surveys of teachers at this point. This was one that was conducted in New Orleans at the end of the last academic year. And not surprisingly, again, some of these same themes coming out: concerns about lack of connection to students, online teaching challenges, lack of student and family resources, and the list goes on. This came out of a conference that was conducted this summer where they asked school leaders what their biggest concerns or stressors were. And you can see those that are bigger here reflect the terms that came up the most in the survey. So you can see not having answers, uncertainty, unpredictability, learning loss. And then for our educators, things like meeting the needs of struggling students, missing their students, feeling helpless, separation anxiety, unable to reach students. So our educators and our school leaders are concerned. And now we know that many of our young people are returning or already have returned to the classroom. And there is great burden on our educators, many who have felt undervalued in the context of the COVID pandemic and are trying to navigate a new learning landscape even as they return to schools. So all of this together really has created a landscape for school mental health that is incredibly complex, not just for our students and families, but also for our educators. So how are our schools responding? You can see here that the next section we wanted to move into is on school mental health, and in this case, comprehensive school mental health systems. And I'm going to go ahead and turn it over to Dr. Reeves, who is going to tell us a little bit about comprehensive school mental health systems.
Thanks, Sharon. Yes, so from all of that, we realized that there's lots of increased need and lots of increased stress, putting comprehensive school mental health really in the center, again, for how we can help and support our school communities. And just before we move forward, I want to make sure I touch base on what we mean by comprehensive school mental health services. And this is providing a full array of supports and services for kiddos. So not just tier 3 supports, but really focusing on promoting mental health and well-being, thinking about how to promote pro-social skills and social emotional learning, as well as taking care of our teachers too. And we want to build on a strong foundation of professionals or collaborators and families and students. We want to bring as many people as we can to the table to really have a collaborative team that is dedicated to and represents the different stakeholders in school mental health, including the students who use it and their families. So these strategic partnerships really help make a strong foundation for our school mental health systems. And then the last bullet there is just to also remember to think about the social and environmental factors that impact health and mental health. So what our centers look like, what our schools look like, the things that kind of happen outside of the environment that impact our kids. So these 3 kind of bullets really help give us a overview of what makes up comprehensive school mental health. And as Sharon mentioned, there are some things that are always true, and there are some things that are very true right now. And this is just been our approach to school mental health as we've been going through this pandemic with everybody as well. So we're going to share a few resources of have this now and always perspective. So as Dr. Hoover mentioned, there's lots of increased need, and there's also still true that many students receive their mental health care at school, and that about 20% of students receive some of their mental health services at school annually. So while there is increased need, there is also some increased burden on schools to be able to support additional mental health needs. The next slide is a guidance document. So we know that this audience may include people who feel like they've got a really good comprehensive grasp of their school mental health system, and then other people who are starting out and building their teams and their infrastructure. So this is a great guidance document to give suggestions and best practices and go over the core features of comprehensive school mental health to allow you guys to figure out where you want to start, and also provide some examples from local and state spotlights so you can see what your colleagues are doing in this area and provide some reinforcement that it can get done. And this is just a diagram of our core features. So the things that we really try to emphasize that are important for comprehensive school mental health. So capitalizing on the specialties of your staff that are available in your school, as well as creating these partnerships with outside providers and families and schools to round out your teams. Additionally, we also think that it's important to do a needs assessment and figure out what resources are available to your students and families and where the gaps are in your services and supports, so that you can use your time together and your teamwork to to improve the areas that are most important for your network and your school community, while also servicing kids on a multiple levels. So having some tiered structure to your environment, and as always, figuring out the money and how you will provide these services and the data that can help back up the impact of your school mental health services. So this is an example of the roles and resources that community partners in school districts can have. So these are just a way to visualize how they can be supportive of complementing what's already going on and what's already going well in school districts. So community partners can come in and help really provide those tier 3 services when it feels like that is a need at the school by school districts. So this is just a good representation of how those partnerships can help support each other and complement each other. All right, so we're gonna go into some of our tier 1 strategies that might be helpful now and when we're all back in school someday. So our tier 1 is our universal strategies. So they are the things that are going to be happening at a school level, and kids are not referred to services for the universal strategies. They are just things that are available or ongoing initiatives that are happening at your school that are centered or geared towards all of your teachers or all of your students. And then tier 2 and tier 3 are a little more intensive, and kids are typically screened into those additional supports and are a little more targeted on different presenting concerns. And our universal strategies cover things like mental health literacy and SEL, or our crisis response, so like psychological first aid. Those would be considered tier 3 interventions. And as we go through, we're going to go through some a little more specifically. This one is, everyone's tired of hearing like, oh, just do some yoga or just relax. So we're going to try to give some additional strategies here on how to incorporate coping strategies or relaxation into our universal strategies for school communities. This next slide has some really good resources for teachers. And as I saw from the chat box, there's a lot of concern for teachers right now and feeling stressed and feeling exhausted and feeling a little burnt out by the virtual aspect of it and not being able to get that reinforcement and connection with their students. So these are great resources for your teachers. And the first one, the WISE, the well-being in school environments, is a workbook that helps you develop your own personal well-being plan. It's written for teachers and educators and those working for schools. So they have some useful things in there as well for students. The other one, the support for teachers that are affected by trauma, the STAT, is to develop your self-care plan as well. And it will help you identify things that are consistent with your values and your needs, so it's easier to incorporate them on a day-to-day basis. The one from UCLA is deals with secondary traumatic stress. So it will help address some of those issues that teachers take home with them. Because like we said, students are having a difficult time, families are having a difficult time. So providing teachers with some resources on how to deal with that and what it's like when you have to take some of that home. And then the last one is a compassion resilience toolkit. And that is out of Wisconsin, and it offers facilitator resources to help build the capacity for helping professionals and caregivers in the systems that they serve. This next one is a resource out of the Sacramento City Unified School District, and it is a virtual calming room. I went to this website. It is fantastic, and it has lots of different strategies and resources to incorporate into your day-to-day life. It will give you sounds. It will help with guided meditations. They will let you watch some live animals. So it has some variety so that you can choose the things that work for you. The next slide is about the guide curriculum and mental health literacy. So this curriculum, which we use with our students here in Baltimore, and we have been able to implement it virtually. Clinicians have been doing an awesome job of figuring out ways to adapt it and to make it so that it works in our virtual distance learning, especially since time has been constricted from what can be dedicated to SEL work. So some clinicians are going into classrooms and for 15 minutes and doing the curriculum one topic at a time, as opposed to doing the full thing for the full 45 minutes. So people are getting creative and kids are really responding to learning more about mental health. And this really helps give kids language around mental health and what it means to have a mental health disorder or what it means to have mental health in general, and addresses things around stigma. And it also provides opportunities for kids to learn how to use their help-seeking behaviors to get help, or what to do when a friend is having a hard time. So that is one resource we use. This one is going to be available later on in the spring, but it is a free 3.5-hour mental health literacy online course for teachers and staff that is developed by the MHTCC, I always forget how to say it, Mental Health Technology Transfer Center Network, in partnership with the National Center for School Mental Health. And it is really developed to give teacher resources on how to address mental health concerns in their classroom. And it will go through a couple of different things, like how to create environments that are conducive to positive mental health. So creating routines, establishing clear rules, how to organize your physical space. It'll also give opportunities to for understanding and supporting students experiencing adversity and distress, and learning more about how trauma and adversity impact learning and behavior. So it gives additional didactic resources around stress and trauma as well. And we've incorporated real live kids into it. So to make it more enjoyable, more interactive, more real and genuine for the participants who are watching it. So there are videos throughout and little role plays and examples throughout to help support teacher learning. Okay, so we want to hear from you. What are some of the universal supports that have been successful in your schools during COVID-19? I'm going to down here. So the whys that it will be available, they're shooting for late April. This looks like some people are using Ruler, doing some additional screening around depression and anxiety. Virtual calming rooms, lunch bunches. Okay, parent education. Ooh, art therapy. I would like to do that, especially with some toddlers. That sounds like fun. And using Google Classrooms to push information out. Thank you guys. Keep dropping them in the chat and sharing with your colleagues. Wellness Wednesdays, doing some family supports. Sounds like you guys have used some great strategies during this time to keep up this universal tier 1 strategies. Worry groups, rainbow days. I'm interested to hear what rainbow days are. Oh, and youth councils. So as we're talking about this now and always, in the pandemic and while we're distance learning, it can also be really important to help create routine and encourage people to and ensure them that everyone is going through the same time right now. As Sharon mentioned, there's lots of kids out of school across the globe. We are all trying to figure it out. So encouraging reassurance, establishing routines, giving strategies for regulation, those are things that you can do that would be really helpful right now. And as I said, we are using the guide in Baltimore and some of our schools, so there are ways to continue doing some SEL work during the virtual learning. All right, I'm going to shift it back over to Sharon to do tier 2 and 3.
Great, thank you so much, Dr. Reeves. So we're going to work our way up the triangle here, and as Dr. Reeves shared, schools are continuing some of the supports that have been in place pre-COVID. They're putting those in place now. We are hoping and actually seeing in a number of communities that there has been an increase in allocation for resources to support these types of universal mental health programming and practices, given the anticipated need in terms of social emotional needs of our young people coming back to schools. We're also seeing advocacy around increased supports at tiers 2 and 3. And when we think about tiers 2 and 3, as Dr. Reeves already mentioned, this is really where we're talking about early identification, intervention, and treatment in schools, and crisis response in the event of crises in the school or community. So let's just talk about some of the things that we've seen happening in schools, both pre-COVID and in the context of COVID. So one of the things that we have seen ramping up in a number of communities is what some are calling well-being checkups in schools. Some call it mental health screening. Some people have really kind of broadened this to represent something beyond just screening for pathology per se, but really screening more for things that include subjective well-being, connectedness to school, connectedness to peers, and some of those factors that are actually more predictive of student functioning. So we've seen some schools ramping that up pre-COVID, but I would say in the last year, I know our National Center has had just so many requests about how can we ensure that we are not having kids fall through the cracks, or how can we assure that we're getting the supports in place and identifying those students who might need additional support as they return to school. Some of this is being done in the context of social emotional learning curricula. So Sam mentioned one, the mental health guide, but there are a number of states that now have mandated K through 12 mental health literacy in the curriculum. And within that, we're seeing some schools actually integrate well-being checkups as a way to also understand how students are doing and a way for them to seek help as needed. A number of schools have put mental health treatment right in the school building, and this includes evidence-based psychosocial interventions at tiers 2 and also individualized and family supports at tier 3. We've also seen a number of schools that have partnered with psychiatry to actually provide psychiatric care right in the school setting. Why do we do this? We know that when mental health treatment is offered in the school setting, young people are far more likely not only to initiate supports and services, but also to complete it. This is just one study that reflects this truth, which is, this was actually done post-Katrina, post-Hurricane Katrina, where students were randomized to receive either evidence-based mental health treatment in the community or in the schools. And what they found here, and now has since been replicated in different studies, youth were about 6 times more likely to complete evidence-based mental health treatment when it was offered in the school. So not surprising to those of us who have worked in schools, young people are more likely to stay engaged and to initiate treatment in the first place when it's offered in schools. There are also a number of interventions that have been designed specifically for use in schools, in part because we know that young people are more likely to access care in the school environment. So we are curious to hear from you. I loved seeing some of the things that your schools were already doing at the universal level. What have you seen in terms of early identification and intervention, treatment, and crisis supports that have been successful during COVID? I'm curious to hear kind of if you've seen innovations in your communities. I'm seeing here a question about information about which states are doing well-being checkups. The first time that I actually saw that term being used was in the context of Los Angeles Unified School District as part of their mental health literacy learning in the classroom. They were having students with family consent engage in well-being checkups. Our partners also at the University of California, Santa Barbara, if you go to a site, and Sam, you may be able to put this in the chat box, but Co-Vitality is a site where they actually talk about doing this type of well-being check in the school environment, where you're not just asking about psychopathology, but you're also asking about these kind of more well-being factors. I see we have a response that resilience builder curriculum over Zoom in the classrooms is one thing that's happening. That's fantastic. So any other types of interventions or treatments that you have seen be successful in your schools during COVID? In Connecticut, a great mobile crisis program. We're seeing here that anyone can call and identify a child in need. We've seen real advances in our mobile crisis response systems in the context of COVID, and we hope that those just continue to evolve at this stage. In Roswell, New Mexico, we're implementing school-based health center, and this is week 1. Congratulations. And school children have been referred. Oh, they've declined to speak so far, it sounds like. And we know that part of that may be related to mental health stigma, but we've seen school-based health centers as a really successful model of how to integrate primary care and mental health in the school setting. So we're seeing a lot of things pop up now in the chat box. With one that I just want to highlight here, one of our providers in a rural school system in Kentucky mentions the agency contract with the public schools. And one of the things that we have certainly seen crop up even more so in the context of COVID are these school community partnerships, where memoranda of understanding are generated between the school system and community behavioral health providers, such that often the community mental health provider can come into the school setting and provide supports and services during the day, not to replace the services that are offered by our school psychologists, school social workers, school nurses, school counselors, but really to supplement some of the great foundational work that's already being done. We know that there is quite a high no-show rate in our traditional community mental health settings. And so by integrating the services right there into the school building, we can really see better access to care, particularly for some of our more vulnerable students, where access to care is really problematic. Yeah, so I'm seeing some great comments here in the chat box. local community services board, and we've partnered with the public schools to provide outpatient counseling in the schools at no cost to families. That's excellent. So really just a lot of examples here that we're seeing in the chat box. And I encourage you all to look at some of the creative ways that schools are doing this work, both pre-COVID, but also perhaps some new partnerships being established in the context of COVID. I'm seeing here another suggestion, Suite 360, a self-guided wellness curriculum for teachers and counselors. They can guide students for additional wellness tips. That's fantastic. So keep these resources coming. I'm going to mention a few things that we have seen crop up in the context of COVID. We've seen more than ever these kind of daily or weekly check-ins that have been initiated by either the student support staff, like your school psychologists, school counselors, even the school administrators, or by the frontline educators themselves in the classroom with the support of their student support staff. And these are a couple of examples that are listed here. So we've seen more sophisticated systems. CloseGap is one example of that. This is a free online tool where teachers essentially get a dashboard of their students, and it can be done both in in-person learning environments as well as virtually. And we've seen loads of schools now using this as a way for teachers to kind of get a pulse on how their students are doing. So even if they are seeing the cameras off screen, they send a link to the students, and the students can use this interface, this dashboard, to essentially say, here's how I'm doing today, and hey, I might need to talk to somebody, or here's what I could use help with. So sophisticated systems all the way to kind of Google Docs, right? So you see a link here, which was an example that was generated by a school system, and it's now been copied and shared with districts all across the nation. We see students going in, teachers sharing this as a way for students just to indicate, here's how I'm feeling today, and yes, I do need to speak with someone, or no, I don't. And it's just a way that teachers can ensure that they're trying to, again, keep the pulse on the emotional well-being of students in their class. This is the CloseGap dashboard that I mentioned. I know they now have one for teens as well. And I see a question in the chat box that relates to this next topic, which is about screening. So we have had a number of school districts that are ramping up their screening efforts at this stage, again, in the interest of responding to the anticipated increase in mental health concerns of students. And so these are some of the constructs or topics that schools are considering when they're looking at screening students. So many of you may have seen the screening tools that have rolled out that are very specific to the impact of COVID. Some of these are mentioned here. Some have been developed for research purposes, and then some have been really developed more with schools and clinical contexts in mind. So there are a number that are child and adolescent specific, and you can Google them and find them, or as Sam mentioned in the chat box, the SHAPE system, which Sam will speak to momentarily, has a free online inventory of all sorts of screening tools that you can check out. We also are seeing more schools asking about life satisfaction, subjective well-being, psychological distress, positive functioning, social influencers of health. So you can see those here. And thanks for putting some of those links in the chat box. So we've seen a lot of this happening in schools. We've also seen a real shift in tier 2 and 3 strategies that schools are using. We have seen so many mental health clinicians working in schools or partnering with schools to offer interventions online. And I continue to be amazed by the creativity and effort of our clinicians. We know that there have been a number of parameter shifts in what is allowable in terms of telehealth. And this has really been, I think, to the benefit of our young people, our families, and our mental health providers. We know that some students and families prefer telehealth. And so we hope that advocacy for these loosening of parameters will continue because we know that this could be really a kind of a new way to open doors for young people and families and schools. We've seen a number of schools and professionals seeking out professional development on telehealth. The Mental Health Technology Transfer Center network that Dr. Reeves mentioned earlier hosts regular telehealth webinars. If you haven't seen those, we encourage you to check them out. We have some on our schoolmentalhealth.org website that speak specifically to how do you use telehealth? What are some of the things you need to consider as a provider and as a student and family in terms of doing this work with schools. We've also seen adaptations of existing evidence-based interventions. Here's one example of the CBITS intervention that was transitioned or adapted for online support. So they pulled from this version of it, they pulled the trauma narrative out and really focused more on coping skills. We've also seen some interventions where trauma interventions where they've kept the trauma narrative in, but really provided very clear guidance about how to do that in a safe and supportive way online. We've seen that, and this is from our colleagues at the Center for Childhood Resilience in Chicago, that technology has increased engagement, novelty, and fun in some behavioral health interventions. And again, our clinicians have been creative in terms of helping to generalize skills outside of that face-to-face interaction. And some have indicated that using these technology platforms has actually reduced some of the barriers to caregiver involvement in school services. So we have a number of mental health clinicians who work in our schools across Baltimore who have said that some families that they hadn't engaged with before, now with the students at home, they've been able to engage more with families. So there may be opportunities that we really can leverage moving forward. Again, this just speaks to the creativity of clinicians. We've seen them come up with these virtual therapy rooms. This is just one example where you can pull this up on your screen and students can actually click on everything on here, all the way from a feelings chart to a fishbowl that guides you to kind of a fish breathing relaxation exercise that you can do. This is one for secondary students that takes your secondary students to some different apps that they can use to calm down, to learn new skills, etc. So again, a lot of creativity in our mental health clinicians. Hopefully you can access some of these resources. I'm seeing links drop into here. The one that was just shared now is called, it comes from our partners at Trails to Wellness, and these are free online resources specific to COVID response. They came up with cognitive behavioral and mindfulness-based interventions from, I want to say, 3rd grade to 12th grade that can be implemented in the school setting. And I know our clinicians are now using this in our schools. So again, just some great resources to provide these tier 2 and tier 3 interventions. Sam already touched on psychological first aid, and there's also the PREPARE curriculum from the National Association of School Psychologists. Both of these crisis response models, which are really intended to be trained for your whole school environment prior to a crisis, they have been drawn upon for lessons and kind of practices to use in the context of COVID. So this, for example, is the school version of psychological first aid, which is called Listen, Protect, Connect, Model, and Teach. And it comes from our partners at the National Child Traumatic Stress Network. And it's all available freely online. And there's some real gems in here for how teachers can respond to students in crisis. And in many respects, all of our students and families and educators are in a global crisis right now. So these tools that have been designed for specific community crises have been used increasingly just in how do we respond as teachers, as school administrators to the crisis that we are in. And I'm seeing here a comment from Faith that tech has been a necessary stopgap measure during the pandemic and raised important concerns about disparities and problematic long-term effects of overuse of tech in the classrooms once schools are back to normal. So I couldn't agree more, Faith, that this has really brought up some questions for what is the right level of tech? How do we match tech needs and kind of strengths to students and families and educators, and what is too much, right? So how will educators use tech as we move forward? Really important question. So I'm going to go ahead and pass it back to Dr. Reeves to share just a few more resources when thinking from more of a kind of district and system level as to how you can advance school mental health. And I believe we're going to try to open it up for some questions as well. Dr. Reeves.
Thanks, Sharon. So on the next slide, there is a link that will be put in the chat box to the National School Mental Health Curriculum, again, from the Mental Health Technology Transfer Center Network in partnership with the National Center for School Mental Health. And this really breaks down the core features of school mental health and allows you to self-direct your way through modules dedicated to each of these foundational items with best practices, with strategic planning guides to really help, as Sharon said, decide from a systems perspective what you kind of want to focus on in what area. The next resource is the SHAPE system. So the SHAPE system holds our national performance standards and our school mental health profile. And this gives you access to the school mental health profile, which allows you to inventory what data you have, how you use that data, what is your staffing like, and what kind of services are provided. So it gives you kind of an overall view of what you have in your system right now. And it kind of serves as like a needs assessment of where your gaps might be and where your strengths are. The other thing that's on there is a school mental health quality assessment, and it allows you to rate your system on how frequently you are using certain best practices. And then from there, it will generate a report for you that gives you an idea of where you might want to focus your quality improvement efforts, and lots of resources around best practices and worksheets and things to help with your planning so that you can move forward in your quality improvement initiatives. And here is some more detailed information about the SHAPE system and what is on there, including those 2 assessments, as well as there's one for trauma-informed schools as well. And as I put in the chat box, there's a screening library as well that lets you filter the results by your presenting concern or area that you are looking to screen students around, an age group, to help narrow it down for you and provide some additional information about those resources. And we also want to say that we are accepting applications for our coin. And this is where we are going to work with state teams who are supporting typically 5 districts within their state around their quality improvement initiatives. So this is an opportunity to really deep dive into an area, get some technical assistance and support. There's a learning collaborative element to it, so it allows you to share with your colleagues and support them as well with all your great innovations that you are doing in your school communities. So this is another opportunity if you are considering deep diving into your quality improvement initiative. So we want to put that out as a resource as well. And we would love to see your applications. And now we have time for questions.
So we don't have too many questions from the chat. You all did such a great job in addressing those throughout the presentation. We did have a couple of questions around how many of the resources are also applicable to preschool settings or childcare settings. So maybe we can comment about that.
Sure. So some of the resources that we shared certainly are applicable and even many have been used in early childhood settings. Some of the well-being resources shared early on, some of the mindfulness resources, the teacher support, some of the social emotional learning resources, although some, as you'll see if you explore them, were designed specifically for K through 12. I know that Dr. Reeves has a specialty in early childhood and is working actually with our national partners right now on adapting the school mental health quality assessment and all of the resources on SHAPE for early childhood settings. And so that will be coming out soon. And Sam, I don't know if there's anything else that you wanted to share with respect to the early childhood resources.
Yes, and the Castle is always a good place to look for SEL information for preschoolers as well. And I'll also drop in the chat a center over at Georgetown that has lots of information for early childhood resources as well.
Excellent. I'm seeing a question from Jennifer about is COIN only available to schools, or can behavioral health who have teams in schools apply? So the COIN application that we mentioned is actually for state leadership to lead the application. And often it's done, this will be our 3rd cohort of this learning collaborative. Often the leads from the state are from education and behavioral health agencies or authorities. And then the districts themselves, we do ask that the education system be at the table, but behavioral health partners who are working in schools can be a part of that district team. So it's a state level application with 5 districts that are being supported, and often the partnerships that are being supported at that local level really are that school community behavioral health partnership. I'm seeing Brianna, how would you encourage schools to allow contracted school behavioral health therapists to come back into the school setting, seeing the need? Since COVID, they're not allowing outside agencies or anyone really to come in. We've heard this cropping up all over, and it's really been highly variable in terms of how schools are navigating this. I think the best thing to do is find examples of where districts and even states, state policy recommendations do encourage community behavioral health partners coming in. There are, and I'm happy to look into some of those and share them either via email if you reach out or on our website, because this has been an increasingly an increasing area of interest and concern. But there are a number of districts who are making allowances for health and behavioral health providers because, as you said, there's such a need. And so they're considering them essentially essential personnel in the school building and making exceptions and adding that to memoranda of understanding. It's a hard area because we know that schools are trying to navigate the public health and safety considerations of COVID transmission, and at the same time, are trying to support the well-being of students. So we recognize they have difficult decisions to make, but there are a number of examples where behavioral health providers are being let into school buildings, and we're happy to share some of those. And if you can find them within your own state or neighboring communities, that's often kind of the input that school and district leaders need to hear, that others are doing it as well. And here's kind of the policy and how it was written. We're seeing in Roswell, we're doing telephonic and considering utilizing GoToMeeting app for video. So that's certainly another option. We've been doing in our Baltimore City schools, we've been using telehealth for a year now. And so it may be that until you're physically allowed back in the buildings, that the school can provide some sort of space for your providers to be able to use virtual technology to do the work. And I'm seeing a couple of examples in the chat box of others who are actually using these memoranda of understanding to do these school community partnerships. Another question here, is there anything to help identify the roles of school-based mental health professionals? Oftentimes school counselors are confused with mental health professionals, and it's difficult to recommend appropriate services when students and family are confused on service offering. So great question. And I've seen some really nice descriptions. It's sometimes hard because the roles of different mental health providers does vary from community to community, even within schools in districts. And so we often are reluctant to be too prescriptive about this is what school psychologists do, this is what school social workers do. At the same time, I know in our national school mental health curriculum, we have some language around it. And then in the classroom-wise course that was mentioned earlier in the presentation, which is a training for teachers, there is a whole section that describes, these are the general roles of your student support team members: school psychologists, social workers, school health professionals, school counselors, community behavioral health professionals, other natural supports. So I'm happy to send that language if you want to email individually, but you can also find it in both of those areas. Any other questions? We'd be happy to take them. We did see a couple of questions on, is SHAPE a free resource? It is. I believe all the resources that we shared today are no cost. For those of us who have worked in schools before, we know cost is critical, and no cost is the best cost. So we try to share often federally funded, or even those resources that have been generated by school districts that have gone into the public domain. We're being asked. Yep, go ahead, Sam.
There's just one question that came through the Q&A and not the chat box. So it says, great. I'm not sure if this was already addressed, but does SHAPE include an assessment on equitable practices in schools, both from a student perspective, like examining office referrals and crisis treatment referrals, and at a staff level, so hiring and retention of BIPOC staff.
Yep. So I have two answers to that. One is that the instrument itself, which is the main instrument that schools and districts complete, the school mental health quality assessment, does ask indicators and has best practices for each indicator. And it does attend to issues of equity and cultural responsiveness throughout the assessment, including things like, are you disaggregating your data when it comes to discipline referrals, mental health referrals? But at the same time, the second response to the question is we actually are going through what's called a Delphi process right now, where we're putting the instrument out to the field to have a new examination of the instrument to see, are we doing the best we can in terms of incorporating cultural responsiveness, anti-racism, and equity with a refined version of the instrument anticipated in the fall. I did see another question. Oh, it was kind of to the whole audience. So for any of you, what SEL curricula are folks using that you like? And I saw one response so far, which was about the PATHS curriculum. Promoting alternative thinking strategies is what that acronym stands for. There are a number that are out there. Sam mentioned CASTLE, the Collaborative for Academic, Social, and Emotional Learning. They have some really great tools and a review of the different social emotional learning curricula that exist. Second Step is mentioned, EduMotion. So we're seeing a number of those in the chat box. It's always great to hear from folks out in the field. I did see a question asking for a link to the COIN application. It looks like Sam shared that. Thank you. So if you think your state would be interested in that, we've had a number of states at this point, about 20 states that have signed on either to advance, in prior cohorts, I should say, to advance school health services or school mental health services. So we encourage you to check that out. And I'm seeing more about Olveus bullying. That's another example of Tier 1. There's a question about how to enroll in WISE. So Sam, I'm wondering if you can find the Classroom WISE link. My guess is if folks Google MHTTC and Classroom WISE, you'll find it. There is, or at least there was, a way that you could indicate your interest in being the first to know when WISE is made available. But it's something that once it is released in the next handful of weeks, that it will be available publicly to all educators. So you'll be able to enroll simply by going to, my understanding is that it's going to be at classroomwise.org will be the website address. But for now, you can go to the MHTTC network site, and I believe they have a specific page for ClassroomWise that Sam just put in. Thank you. And is that the, okay, there we go. Yeah, so thank you so much. That is the ClassroomWise page, and that will take you to the interest form. So you can be the first to know. And beyond ClassroomWise, for those of you who may not yet be connected to the Mental Health Technology Transfer Center network sites, there are regional centers across the nation, as well as some special population centers, and they have all received supplemental funding to advance school mental health work. And so if you're not already connected to the work that they're doing, I encourage you to get connected because they have some great resources, and ClassroomWise is just one. Lisa, any other questions? Oh, CASTLE. And okay, so I wonder, Sam, if you can share the CASTLE resource. And just of note, it's CASEL. For those of you who may be thinking like a sandcastle spelling, it's more the CASTLE that stands for Collaborative Academic and Social Emotional Learning. And Julia shared one example of an SEL curricula, high scope, that's within the pyramid model, which is often used in early childhood settings. Thank you for sharing that resource. Any other questions that folks have about advancing school mental health in your setting, or any other resources that folks want to share?
I'm not seeing any other questions popping up that you all haven't answered.
Okay. Well, in that case, Lisa, I imagine that folks may be eager. Oh, let's see. I would encourage looking for ways to engage families and communities. Thank you, Anne, for that comment. In fact, I think that's a wonderful way to close out our work with you today. One of the core principles of the work that we do at our National Center for School Mental Health is that all the work we do is in partnership with our students and our families. We talk about the work that we do being a shared agenda between students, families, schools, and communities. And so hopefully in all that we do and in all that you do to develop and sustain your school mental health systems, you're doing so in strong partnership with students and with families. And we really appreciate those of you who took the time today to join in with us and to share your own ideas and questions. And hopefully you were able to take something away today that will help school mental health in your community or in your home setting. And we appreciate your time. We know everyone is very busy these days. So thanks so much, and feel free to reach out afterwards. We're always happy to share the resources, happy to share the slides, and always happy to learn from you all in the field. Thank you so much.
Thank you to our outstanding presenters, Dr. Hoover and Dr. Reeves, for sharing their expertise and strategies with us today. And thank you to our interpreters, Lawana and Travis. And thanks to all of you for joining us for this segment of Training Institutes Live. We hope that you take advantage of the wellness break before you join the next set of workshops that will begin at 3:30. If you have not registered for one of the two workshops beginning at 3:30, it is not too late. The link is being posted now in the chat. Also, we would very much appreciate your taking a few moments to complete the evaluation for this workshop using the link that is posted in the chat. Your feedback will help us to shape the upcoming workshops in this series. Again, thank you for joining us today, and we look forward to seeing you again after the break and on the first Thursday of every month for Training Institutes Live.